Happy Friday, everybody. My name is Dr. Carl Salee. I'm postdoctoral resident here at the Utah Center for Evidence-Based Treatment and a licensed psychologist. And as the name of the presentation suggests, I will be talking today about the spirit of motivational interviewing. And my hopes for this presentation is less of a how-to guide about how to do motivational interviewing, but about how to foster this heart set and this mindset that is the why and the background of motivational interviewing in a way that you can apply to any work that you're doing, and as a way to help foster some self-compassion for clinicians and decrease your overall level of burnout, because right now we're in some pretty tough times and we're holding a lot of people's pain as clinicians. And that was sort of the heart behind why I wanted to do this presentation. So without further ado, I'm gonna share my screen and get going. Okay, so title slide. So first I will move this out of the way here. And by the way, I can't really see folks chat just with the way this is set up, but I have some folks sending me questions if they do come in through the chat, and I'll do my best to answer those in real time if I can. So I wanted to start with what this presentation is not. This is one time where I might ask folks to unmute and just kind of shout out as you will. What comes up if I were to tell you, like, what do you feel? What is your reaction if I were to tell you, we're gonna by the end of this 1 hour long presentation, we're gonna know how to read this entire piece of sheet music and play it beautifully without any sort of challenge or flaw. What comes up if I say that's what we're doing today?
No way.
No way. Yeah, what else do we got?
Awesome. I want to learn that.
That'd be $10 really well spent.
Yeah, that would be $10 really well spent. And unfortunately, I don't think that I can teach any of you how to do MI in 1 hour. That would be like me trying to sit you down at a piano, and by the end of 1 hour, you can play this piece of sheet music beautifully. So also, this presentation isn't going to teach you how to trick clients into doing what you think they should do. Oftentimes, motivational interviewing gets that reputation as being sort of these like sales tricks or ways to make folks comply, but that's not what this is about. And it's also not a presentation, hopefully, if I do it well, that will increase any burden that you might feel as a helping professional. Instead, what I am more hoping to do is taking the music analogy and the sheet music analogy a little bit further, is hopefully teach in this presentation a set of chords that when played in various cadences, you have the freedom to improvise within those chords, where there's many different routes for that piece of beautiful music to emerge. When in doubt, you'll be able to fall back on these chords in order to kind of get you through the song. You don't have to nail the melody perfectly and hit every single note. You can work on doing your scales and your sheet music later. So I like the metaphor that motivational interviewing is a lot like jazz music. So there's definitely a theory behind it, and there's a general layout of how things go depending on the song. But it's very common to hear the exact same song played in a very different way depending on who's playing it, because of that room for improvising and working with your bandmates. So in classical music, there's oftentimes much less room for error, and it's planned out exactly how you're going to get from point A to point B. When people show up for a symphony, they kind of know what it is that they will be hearing. Whereas with MI, there's less need to do it exactly right according to the sheet music, and more of a desire to learn in real time where the song seems to want to go. And how you learn that is you listen closely and you respond with harmony. You respond in a way that guides the song in the general direction. With MI, you respond in a way that guides a conversation in a general direction. And usually that direction is very dependent on the moment. It's dependent on the stage that the song finds itself in. So I will be going into the mindset and the heart set, the spirit that underlies motivational interviewing. And with each component of the spirit, I'll try to give experiential and behavioral components with examples, so that there's some concreteness to it as well. And then a discussion about how this approach can be transdiagnostic and transtheoretical, and how it can be applied in nearly every therapeutic setting, and also some invitations to allow fostering the spirit of MI to decrease any burnout that you might feel. So I just wanted to share a quote from Miller and Rolnick, who created motivational interviewing, when they were talking about what is MI. And they said, MI is defined or is designed to find a constructive way through the challenges that often arise when a helper ventures into someone else's motivation for change. So I can't really see anybody's thumbnail with this, but the question is, who of you as helping professionals have ever found that it's really challenging as a helper whenever you venture into somebody's motivation to make a change in their life? And this change from your perspective as the helper seems to be the clear choice that would improve their life. I know that this happens to me on a daily basis. And running into these challenges, in my opinion, can be one of the hardest things about being a therapist, about being a helping professional. And it's also one of the easiest routes towards burnout whenever I realize that, oh, wow, I haven't been in the spirit of MI before I tried to venture into exploring somebody else's motivation for change. Requisite spoiler alert for the remaining of this presentation. There will be lots of references to Star Wars, Harry Potter, Lord of the Rings. So if you don't know how those end, I'm very sorry, but they've been out for long enough now that I think it's okay to spoil them. So why focus on the spirit? So doing MI, or focusing on the technique, is something that most of us who've been through a lot of school and who've read a lot of manuals and read a lot of books can do. But there's a little bit less tangibility of focusing on the how MI is practiced. And it's like doing MI, just using the techniques, is kind of like reading lyrics to a song without the accompanying music. It's just not the same. And without the underlying spirit, it just becomes a cynical trick or a way of trying to manipulate people into doing what they don't want to do. So my charge, apologize, I don't know why this is showing up here. Quit mail. Sorry about this, everybody. Thought I had this on Do Not Disturb. Okay. I'm going to share my screen again. Okay. Alrighty. So my charge to all of you, I don't know if anybody saw that, but my email kind of popped up. Okay, I'm getting notes that they didn't see anything. My charge to you all is to be this Qui-Gon Jinn, who is, has an apprentice. He is on equal footing with Obi-Wan here. He provides guidance based off of a certain set of principles, but is not forcing Obi-Wan into anything. And instead, they kind of work together to achieve the same thing, which is for the purpose of him developing and making changes towards a life that he wants to live. And please, if you find yourself in therapy trying to do Jedi mind tricks on your clients, then that probably means that you're not within the spirit of MI. So please don't be this Qui-Gon Jinn who is manipulating and tricking people. So just real quick, somebody shout out, you can unmute. What is the main setting that most people think of when they hear motivational interviewing? What's like the setting or the type of work that is like the instant association? Addiction, exactly. Substance use, which makes sense because that is kind of how it was developed in those settings. And there's a lot of research in that area. But since 1990, and by the way, what I'm pulling this from is a 2013 manual that Rolnick and Miller and Rolnick is their third edition of MI. Since 1990 to 2013, the amount of studies on MI have doubled every 3 years. And in 2013, there were over 1,200 studies from almost every array of problems, professions, treatment settings, and even countries that you could think of. It's not just for substance use. It's much more than a technique to use to get somebody to stop using. And it's in my opinion, highly underutilized if that's what it's considered for. It is effective for that, and it's effective for so much more. And so I just wanted to read this quote here. In all of these effectiveness studies that were, or efficacy studies that were published, they found in this meta-analysis on all of them that the variability in effect size seems to be the norm rather than the exception in MI research. So they were like, okay, there's clearly something going on here, but there's a huge variability in how big of an effect we're finding in all of these thousands of studies. And what it suggests to us is that the client response to MI is significantly influenced by clinician and contextual aspects of delivery, factors that are not adequately standardized by following a treatment manual. And I highlighted that because that's kind of why I'm wanting to talk about the spirit of MI here, is because that's something that's less tangible. You can't really necessarily get from a treatment manual. And so one meta-analysis found that the average effect size of MI was smaller by half when the intervention was manual guided. So that says something. And to kind of talk about this, why so much variation? One of the hypotheses is that manualization is actually kind of opposite to the spirit of motivational interviewing. It can decrease the clinical flexibility that a clinician has going into it. It's often described as being more like a dance than a march or a battle. And it requires some sort of improvisation. A manual implies a right versus wrong way of making change. And a lot of research suggests that implementing a manualized treatment is actually best used when a client is already motivated and ready to make a change. So we think of this idea of the client is in that stage where they're like, okay, I want to start implementing, I want to start acting. And MI was kind of developed out of the spirit of helping somebody reach that stage. Or when they are in the manualized treatment, if they start to waver and they encounter ambivalence along the way. And it's not quite as relevant for individuals already there. And like I said, but not irrelevant either, because we all know that folks go up and down with their level of commitment and of ambivalence through treatment. So one of the core tenets of MI is to evoke the wisdom that's already inside of a client and not assume that we as clinicians know what is best or right for our client. So I think that another piece of data that is important to highlight here from this meta-analysis is that MI alone did not work nearly as well as MI added to treatment as usual, seemed to have better results. So this suggests that MI is really effective as a transdiagnostic adjunct approach, not just something that you throw at a client as a standalone because you're trying to get them to change their behavior. And it suggests that the specific skills of MI on their own are much less effective than skills used with the spirit that underlies all of it. So let's see here, just checking my notes here. So what research seems to say is vital about ensuring MI's effectiveness is that when a clinician can stay within the spirit or the boundaries and apply the skills flexibly within those boundaries, kind of like those jazz chords that I was talking about earlier. All right, so another question, why focus on the spirit? Well, I like to think that most of us probably joined the helping profession, whether we're a therapist, a social worker, what have you, dentists, doctors. I'm not sure who all is here, although I assume it's a lot of therapists. We joined this profession presumably because to some extent or another, we really, really care about helping others reduce their suffering and improve their overall ability to live a life that is well lived. And we go through a lot of school to do this. We become quote unquote experts and we take on responsibilities to help. And while this is noble and oftentimes values driven, we often forget that we actually have no power to make this happen from our wills or from our expertise. Change really occurs because of things that our clients do. And who makes the choice to do those things? The client. We don't make that choice for them. But it can hurt a lot when we want what's best for our clients, but we don't. We want what's best for our clients, but they're not making the changes that we believe would lead to whatever is best. So we start to take on responsibility and burdens that are not ours to carry. And we ultimately can actually end up hurting ourselves and not really helping our clients when we think we know how they want to be helped. So the spirit of MI is a buffer to help us not fall into this cycle of burnout and to increase our effectiveness in helping people make changes because they have made the choice themselves to make that change. So forgetting the core tenets of the spirit of MI can lead to that frustration, that feeling stuck. It can lead to blame games, decreased compassion, manipulation, battles, overall burnout. And I want to help decrease that. So my charge to you here is be this Gandalf who's partying with all of the hobbits. He's dancing. There is again that metaphor that MI should feel a lot more like a dance where you are working together with the client and not a battle. You are not the white Gandalf the White who's appearing at the last minute in Helm's Deep to come and save the day. That's just not how MI works. That's not the spirit. And last but not least, it's a bit of a stretch with this GIF here, but I really wanted to just keep going with that Lord of the Rings metaphor. So why focus on the spirit? Because it's transdiagnostic, trans-theoretical, and transmodal. It's something that we can all apply to how we practice therapy, regardless of what kind of therapy we're doing. So to explain why I included this picture of the Fellowship of the Rings, each of these characters has their own agendas. They all come from different places, and they all have different reasons for joining the Fellowship of the Ring. However, they are as one fellowship, and they are all committed to the spirit of the mission, the how. They know that their own reasons for joining the fellowship are not as important as the overarching mission. And for us providers, the overarching mission should be the same mission that the client has chosen for themselves, even if we have an urgency to change what that mission is, because we think it should be different. So let's see here. So before I jump into the actual 4 components, I wanted to show you all this video of ambivalence and the writing reflex, because I found this extremely helpful when I am noticing myself feeling like I'm wandering dangerously close to that level of burnout. I always think about the writing reflex. And this quote here, if you are arguing for change and your client is arguing against it, you've got it exactly backward. So I I'm going to share this video. I actually have it all loaded up here, so.
Let's return to our example of an ambivalent participant who, like most people considering a change, is balancing back and forth between both sides of an issue. Perhaps they want to quit smoking or eat more healthily. To an outside perspective, the choice between changing and not changing may seem clear. And of course, providers naturally want to encourage and argue for the healthier choice. However, when a provider takes up one side of the argument, the participant feels this shift in balance and wants to defend the opposite. The ambivalent participant doesn't start out voicing only one side of the issue. It's a natural reaction to a provider taking up the opposite half of the discussion. It's at this point that participants are often labeled as resistant or in denial, when in reality, they are simply working to restore their back and forth ambivalent balance. The provider worries they haven't been clear enough, or perhaps haven't provided enough information. The participant responds in kind. Chances are they have collected most of the information and rationales for both sides of the issue. They are not in short supply. The provider becomes insistent, believing that if they can make the participant feel the weight of the consequences, they will come over to the other side. But as research shows, people put the most weight in their own words. They believe what they hear themselves say over what others say. And when confronted with the righting reflex, they hear themselves arguing for all the reasons not to change. When this happens, the righting reflex response is to, as stated in Motivational Interviewing 3rd edition, confront the person with reality, provide the solution, and when you meet resistance, turn up the volume. Such behavior can result in the participant actually convincing themselves they really don't want to change, and even leaving the conversation or treatment setting altogether. This can reinforce a provider's belief that the participant was not ready to change after all, when in fact, it's not a question of readiness to change. It's a question of how comfortable the practitioner is with embracing the artful balancing act of ambivalence.
All right. Okay. So I just wanted to share that video because that kind of helps set the stage for going into the 4 components of the spirit of MI. And the writing reflex is something that is vital to be kind of constantly monitoring for us as clinicians when we're going into meetings or conversations with folks who it's clear that there is some level of ambivalence about making a change in their life. And this can be especially challenging when that level of change is fairly significant, that, you know, we perceive, okay, if they would just make this change, it would make a huge difference. And our perceptions of what changes that they need to make is not really as important as their perception of the changes that they need to make. So the 4 components of the spirit of MI here are collaboration, partnership, acceptance, compassion, and evocation. In this little graph, they said collaboration instead of partnership, same thing. Okay. So partnership, what is it? Seems like a fairly simple thing. It's an awareness of our own values and agenda for change. And it's okay to have those agendas and our own values. I'm not saying don't have them, but it's key to be aware that, oh, this is my value. This is my agenda for change. This is what I think. It's key to be aware of that and to be aware that this could be different than what the client thinks. Considering it a privilege to witness another person's inner life. This one is huge because I know for a fact that I've gone into sessions where I see this client's name on my calendar and it's in the afternoon and I have all day waiting to see them. And the sense of dread is just building and building and building, because it feels like I'm going to be entering into one big battle. And I think we all have had clients like that have triggered the same response in us. And I think being able to be aware of like, why am I having this response? It is a privilege for me to be able to witness another person's inner life. This is a very private, this is a very special thing that I don't just have the right to. And if I can go into this with a curiosity to learn about what their inner experience is from their perspective, then maybe I can also let go of any urge that I have to superimpose my own vision, because I'm able to see the world through their eyes. So we often talk about, I love DBT and ACT. And so, ACT says, let's increase psychological flexibility so that we can live a life that's well lived. DBT has a very similar type statement. Let's learn these skills to help you be effective in living a life that's worth living. Different words, in my opinion, to say very similar sentiments, but we don't know what the client's definition of a life well lived is, or a life that's worth living, unless we're actually curious and listen to find out what that is. And oftentimes it's very easy to fall into these 3 pitfalls that take us out of partnership. And so the first one here that I really want to emphasize is the expert trap. This is a huge one. So the expert trap is tough, and I know that I've been guilty of it many times before. So one of the assumptions in motivational interviewing is that people are the undisputed experts on themselves, and the therapist is not. I am not an expert on anybody except for myself. And we want to be able to activate the expertise that the client has inside of them when they enter the room. And we can't activate this unless we collaborate together. So the expert trap is the belief, and write this one down because this one is huge, the belief that because of my professional expertise, I have the answer to the client's dilemma. This not only inhibits partnership, but it also leads to burnout when we fail, inevitably, at being an expert on the other person. We're falling into a trap of thinking we can do something that we can't. When we think it's our responsibility to make changes in the client's life, that leads to us starting to push our boundaries well beyond what is healthy for our own well-being. We start working harder and harder and harder without any increase in results, because we're essentially spinning our wheels in the wrong direction if we haven't taken the time to learn what the direction is from the client. And we're losing that working relationship that makes therapy effective. So my charge to you here is, please do not be this Ron Swanson. We love Ron Swanson, great guy, funny character. And sometimes, he definitely falls into that expert trap where he says, I know more than you. And if you find yourself thinking, I know more than this person, that can be a very good red flag to say, do I? What do I know more than this person about? Sure, maybe I know more than this person about like the theories of psychology and, who Stephen Hayes is and who Marsha Linehan is, and like, what are the underpinning theoretical developments of DBT, but we don't know more than the client does about their own life and about what a life worth living is for that client. So these are the pitfalls of partnership. Expert trap, if you find yourself trying to convince, and if you're working a lot harder than the client. And I want to highlight, that's kind of a buzzword amongst therapists, is like, oh, you're working harder than the client. That can lead to some sort of like negative judgments about the client, which again, it's okay, but within the spirit of MI, it's okay to have those judgments, but within the spirit of MI, it's good to notice that you have them and be like, wait, why am I working harder than the client? Does this have to do with me, or does this have to do with the client? And is it okay if the client is where they are right now and they're working at the rate that they need to be working at? based on their stage of change. Maybe it's not about trying harder and doing more. Maybe it's about shifting the mindset and the heart set. All right, so for the next 2 slides, I apologize, no funny GIFs. There was just too much text, because within the spirit of MI, they do break acceptance down into 4 different categories. So really within the spirit of MI, there's 4 components, but acceptance is 4 in and of itself. So we'll start with absolute worth. So the experiential aspect of absolute worth is when you have unconditional positive regard and trust. So my main man, Carl Rogers, talks a lot about unconditional positive regard, which is basically this idea that we can trust wholeheartedly that our client is a trustworthy person and that they have an inherent tendency towards growth. We firmly believe that it is circumstances that might be preventing growth, and they may not be motivated, but that is not because they are inherently have conditions that make them not worthy of growth, or that they don't have the tendency to. The next aspect of acceptance is accurate empathy. So this one we talk a lot about when we're in school for becoming a therapist. It's working to see things from the client's frame. Actively asking questions, being curious, and also important to highlight the experiential aspect of assuming that it's actually a worthwhile endeavor to do this. And thirdly, this is the one that oftentimes gets left out, but accurate empathy means nothing unless the client experiences it. We may think that we're being accurately empathic, but the client is like, no, way off. This guy's not understanding where I'm coming from. And so it's important to check for feedback of whether or not we're actually accurately empathizing with the client. The next, this is autonomy support, and this is one of the biggest ones for that is burnout inducing, at least for me. And I'll kind of explain why in a second, but what is it? Autonomy support, it's the assumption of the irrevocable right to self-direction and growth given the correct conditions. And I know that right or correct is very subjective, and that's kind of the point. Those conditions are different for every client. And it's our job to support finding what those conditions need to be. And then behaviorally relinquishing the burdensome belief that I, as a therapist, that any of us as a therapist can actually make somebody change. And I think this, I've already touched on that, is extremely hard to do. It's one of the most burnout inducing things, is when we hold on to the burden that somehow it's my responsibility that this other person makes changes in their life. And this actually leads towards the expert trap. Okay. And again, we know that the expert trap is not something that is within the spirit of MI. And then lastly, this one's really important too. Part of acceptance is affirmation. So truly acknowledging the strengths and the efforts of a client. So we can, inside of our own heads, acknowledge, oh, wow, this person really made a huge effort this week. Or this person's got such and such strength. They're a very relatable person, and they seem to have a lot of compassion and care. And again, though, similar to checking for feedback of your accuracy of empathy, affirmation is only halfway there if we don't behaviorally communicate that we're acknowledging the client's strengths and efforts during session. So that is one of the biggest keys here when we're talking about the spirit of MI, is actually communicating and acknowledging that we recognize this person is doing the best they can. We recognize that given the circumstances, the client is not without strength or without wisdom. So far, I just wanted to point out that, well, actually, I'll get to that in a second. So what are the pitfalls of acceptance? I liked this quote here: approval or disapproval are irrelevant. So one of the pitfalls right away is if we misconstrue acceptance with approval or disapproval. We as therapists come into the room with our own values, our own morals. We don't really have to approve of what our client is doing. And we also don't really have to disapprove of it either. It doesn't really matter. Can we accept? Can we see that this person has unconditional, worthiness as a human being? So the pitfall for absolute worth is that, and putting conditions of worth on your client. So I can't tell you how crazy it drives me when I hear people saying things like, "Oh, this person's borderline. No wonder they aren't a good client." Just the fact of labeling somebody as a good or bad client in and of itself is taking us outside of the spirit of motivational interviewing. We're saying, "Oh, well, this person, like, they're only worth my time if they're motivated." Would they be worth your time if they're not motivated? Is this person worthy of being seen and communicated with and affirmed as a worthy individual, even if they have the lowest level of motivation you've ever seen? That's a good question to be asking. And I know for a fact I've had these very thoughts before. I'm just as guilty as the next person of putting conditions of worth on my clients. And it's something that I've noticed when I start doing that, straight down the road to burnout, straight down the road of saying, I don't want to do my job anymore. This sucks. I'm feeling too tired. Another pitfall of acceptance when it comes to accurate empathy is feeling sympathy, pity, camaraderie, starting to identify with the client. So accurate empathy isn't like saying, "Oh, I totally like get what you're going through because I went through the same thing myself here." Well, it may be similar, but it's not the same thing. And we can feel sympathy. We can feel pity and camaraderie. I know there's clients I have who I kind of think, "Oh man, if this weren't my client, they'd probably be a pretty cool friend to have. Like, we share a lot of the same interests and whatnot." But that's not empathy. That's different. So it's just important to be watching out for whether or not we're mistaking those for accurate empathy. And of course, imposing your own perspective. I can think of at least a couple times within the last week where I was working with clients and I found myself going into like lecture mode, found myself going into like giving psychoeducation without even asking if it's something that the client wanted to hear, or like a piece of advice just started sort of bubbling out of my mouth. And I'm like, wait, there's no advice that I can give that's going to be more powerful than the wisdom that this person already has within themselves. My advice will always fall short. And my advice is not based off of accurate empathy either. Pitfalls for autonomy and support. When you find yourself wanting to make the client do something, that experience that probably all of us have had of being like, I just want to shake this person and make them do what I think they should do. Or if you find yourself saying things like, well, I don't think this is an option for you. You can't do that. You don't have a choice, or you need to do such and such if you want, such and such. While it can be very easy to fall into this, those are implying that if the client were to want to make a different choice, you would not, you would drop the support that you have of that client. And again, you don't have to approve of their choices, not the same thing, but supporting the client unconditionally, supporting that they have the irrevocable right to self-direction, means that we can't, here I go again, we can't, means that we are falling outside of the spirit of MI if we say these types of things to our clients. And then lastly, affirmation pitfalls. So this is a big one. You find yourself searching for what is wrong with the client. You're operating from a deficits-based approach. I need to figure out what's missing in this client and fix it. And behaviorally, it's a pitfall if you are not outwardly expressing that you acknowledge the client's strengths and efforts that they're making. So those are some of the pitfalls of acceptance. All right, compassion, moving on. What is it? So experientially, compassion is the ongoing, deliberate commitment to pursue the best interests of our client. And behaviorally, it is engendering a trust from the client that is a real trust. Now, what is real trust? What is not real trust? Trust is not the same thing as certainty. So a client can never be certain that we as therapists are going to protect their best interests and respond in a helpful way when they're being vulnerable. But real trust is they're uncertain about it. They still trust it. They still give us their vulnerability, and we do protect it. So the client can trust that you have their best interests at heart, but really you have your own best interests at heart. That can happen. So that's kind of what I mean by real trust. So to explain why I'm charging you all to be this Boromir, if you've seen Lord of the Rings, Boromir, he's one of the most complex characters in the whole series, because from the start, we aren't really so sure about this guy. He definitely joins the fellowship with pretty explicit self-interest that is different than that of Frodo's interest. He wants to take the ring and he wants to use it for power. He wants to use it for his own people to bring them back to glory. But the thing is, in this scene, we realize that the trust that Frodo has placed in him is real, because he is committed to and is actively doing something that is best for Frodo and best for the fellowship, with this behavior where he's drawing the danger away from the hobbits so they can escape and towards himself. So be this Boromir. And please do not be this Boromir, who he is more at the start of the movie versus at that part. So a pitfall for compassion is experientially if we find ourselves taking a salesperson approach. So if we have an agenda going in that we're hoping to achieve in this session, an agenda that we have set before the person even walks in the door, or if you're trying to sell the idea of change to another person or convince them that this is the choice that they should make. We tell our clients not to should on themselves. We shouldn't should on our clients either. And I guess I just should it on all of you. It is not within the spirit of MI to should on our clients, to try to sell them on something. Also, if we find ourselves practicing the skill set of MI, but from a place of self-interest, that is a pitfall of compassion. What I mean by that is, if any of you have gone into a session like I have, especially like my internship was only last year, so I still remember many experiences of going into a session, not necessarily because I had the client's best interest at heart, but because I wanted to show how good of a therapist I was. I wanted to prove that I could do this modality by the books and make zero mistakes while doing it and get a gold star from my supervisor. And that is far from the spirit of compassion. It kind of forgets what we're here for as helpers. So when Boromir joins the fellowship, despite the goal already being laid out to destroy the ring, he tries to convince the group to take his goal of using the ring of power. And he's secretly doing this because he's actually insecure that he's not good enough, because he's not actually in the bloodline of succession for taking over rulership of Gondor. He's just the steward's son. So he's operating from that place of insecurity versus compassion, which I have been known to do myself as well. All right, so we get to evocation, which is what most people think of when they think of MI. They think MI is purely just evocation, but as you can see here, this is only one out of the 4 spirits of MI. Without the other three, this is just kind of like those Jedi mind tricks. So evocation cannot really be an effective form of MI without the rest of the spirit there. So experientially, what is evocation? It's when the conversation feels more like a dance than a wrestling match. You're responding to one another and you're generally both moving in the same direction, but it's a little bit more flowy. It's not a march. It's not a battle between the two of you. And, experientially and behaviorally, you commit to and actually do rely on the client's own wisdom that they already have within them. So this is really challenging. It's when the client does have a nugget of wisdom that gets called forth from inside them that may have been hidden by some level of ambivalence, even if it's not the exact one that you would have chosen as a therapist, behaviorally, you are in the spirit of evocation if you choose to rely on that nugget of wisdom that shows up. And then also operation from a strengths-based assumption. Your client already has what is needed inside of them to change. And all you have to do is call it forth. All you have to do is be a companion guide that helps call forth that wisdom. And I chose this GIF of B. Dumbledore because this is a huge spoiler alert. But Dumbledore knew a lot more about the whole story than he ever let on to Harry. He pretty much knew the prophecy from the start before the first book even starts. He knows how this thing is likely going to have to end in order for, the good side to win and whatnot. But the thing is, he said he met Harry where he was at the different stages of his life and didn't just tell Harry everything that he had to do in order to make this plan come true. He let Harry, throughout the course of the books, find the wisdom and the motivation inside of himself through his own experiences and his own reasonings to eventually find that motivation to do what he needed to do in the end, which was a huge choice that he had to make. And it was not an easy one to make, but it would not have been likely a choice that Harry made if, when Harry got his owl when he was 11 years old, Dumbledore was like, hey, by the way, you're going to have to sacrifice yourself in a battle against Voldemort in order to save the world. Probably wouldn't have worked out that way. So Dumbledore, I think, is a really good metaphor for the spirit of evocation. And again, I love this metaphor too, because Dumbledore was far from perfect in the books. He had so many things that he could have been more effective at. Just like us as therapists, we do not need to be perfect. We make mistakes every day, and that's okay. What's important is that we stay within that spirit of evocation versus the opposite, which is this character, Dolores Umbridge. I still kind of cringe whenever I see her. So, pitfalls of evocation. Again, you're assuming the deficit model of change. So there's something wrong with this person, and if I can just tell them what's wrong, then they'll be good. They'll be able to make that change. Also, you find yourself thinking that you have to provide the answers to their questions or problems. It's more than okay to respond to a request for advice or to respond to a request to answer a question or provide some sort of certainty for the client with, I'm not really sure. I don't know if there's anything I could say that would be more effective than what you already know with your inner wisdom. Behaviorally, if you find yourself lecturing or providing psychoeducation without even asking if it is wanted information, or again, if you find yourself sucked into an argument or a power struggle, or you're wrestling and not dancing. And I chose this GIF of Dolores Umbridge as the opposite of evocation, because when she comes in, she assumes that there's something lacking in all of these students, and she has the correct answer to fill that hole. And so in a sort of militaristic type fashion, she starts basically shoving this unwanted information down all of their throats. And ironically, what ends up happening, if you think back towards that video that I showed with the writing reflex, is that the students really reacted to that. They really reacted to that. So think of a time, if you've ever had a client where you're so certain you know what it is that they need to do to change, and even if you just really gently try to suggest that they do something differently than what they're doing already, and think of a client who may have reacted in the exact opposite way that you would have wanted. It is a documented psychological phenomena of psychological reactance. You tell your toddler clean their room and they don't like being told what to do, so they decide to make a bigger mess than there already was before. In the case of Umbridge, it created Dumbledore's army, which was like definitely not what she wanted. So we're going to try our best within the spirit of MI to not join in power struggles with our clients. So those are the spirit of MI, both what they are and the pitfalls to look out for. This is the end of my presentation. There is a couple of announcements that I wanted to give before opening it up, and I'm realizing there's not like a ton of time left for questions, but I am willing to stay a few minutes afterward if anybody does have questions. But at 11 o'clock or 1 o'clock, if anybody needs to leave, feel free. So, here's my references. Thanks everybody for being here and for attending my presentation. If you have further questions, please send me an email. It's just carl.salee@ucebt.com. And yeah, I love talking about this stuff. It's something that I'm pretty passionate about. So I would welcome any sort of conversation about this. So goodbye, everybody.